Good morning. My name's Robin Hissam. I'm the HR Administrative Assistant, and I cover policies and procedures for Orange Grove. Um, there is a sick bank available once you've reached a year and you've saved up some sick leave, and it can be very helpful. I had to use 2 weeks of it to keep a paycheck going in August of 2018 when my heart stopped, and I used 9 years of sick leave and then used part of the sick bank as well, so you can see how advantageous it can be. And my phone number here is 629-1451, extension 2622. I'm the first door behind the reception desk in the main building. We are a drug and alcohol free company, which means we do random drug screening once a month, which your supervisor will give you 1 day's notice to come to room 31, which is the backside of healthcare services, and you will give a sample, and then we will send it off and have it evaluated, and then you will, if there's totally negative results, then you won't have to worry about anyone contacting you. But if it's positive, an MRO, medical review officer, will contact you and give you a chance to let them know what pharmacy you use in case it's a prescription medication that shows up positive. There's a list of prohibited drugs in your handbook. And inclement weather, TV is a resource. You can watch the news and see whether Orange Grove's going to be delayed or if they're going to be closed for the next day. And always keep in contact with the OGC weather line, which is 423-308-1161. Emergency disaster plans. In every residence that you work in, there are maps hanging around the house that will show you where to meet if it's a tornado or a tornado drill, or if it's a fire drill or an actual fire, where to take the individuals to be safe. Email all@orangegrove.org. Be watching for that because we do job announcements, and if you've been here 90 days and haven't received any write-ups, we have a free policy of being able to transfer interdepartmentally. So keep an eye out in your email for job announcements, and if you want to transfer, you'll come up to HR, and behind the reception desk in the hallway there are forms that every individual has there in case they need to fill it out, and you'll do a step 1, which is an internal job application, and then you'll turn it in to me. I'm the first door behind the reception desk, and I will scan it and send it to the department you're trying to go to. Once they've contacted you, if they want you to transfer to their position, then you'll come back to HR and do a request for transfer, which is step 2, and you'll turn that into me, and then I will notify your current supervisor and the one you're trying to go to. So then they will work out the details of your notice, whether they want you to give a 2-week notice before you transfer. You can also reach your email by going to EPBFI and sign in at Zimbra Web Client Sign In using the same name and password that you would use here at Orange Grove on the computers here. That's where the job announcements are made, is through the all@orangegrove.org. You have 5 days to turn in an internal job application, and then the requisition will go public. Benefits include health and life insurance, dental and vision insurance, long-term disability, life insurance, retirement, and workers' compensation. Workers' compensation, there's a notebook that I will pass out to everyone, and it will explain what you do in case there's an accident. So immediately notify your supervisor, no matter how great or how small the injury is. And on the back page, there's a list of physicians, a panel of physicians that you can go to in case you need to have an x-ray or some other diagnostic testing for the injury you may have received here at Orange Grove. You have to turn this in within 24 hours. Attendance, you need to be on time at at your designated location and remain there for the entire shift. Attendance is important to keep peace in the household. Health and safety. OGC works to make safety a priority, but you must do your part. Universal precautions. You'll learn more about that in CPR and first aid. And unless there's an emergency, you can only work 16 hours straight with 8 hours between shifts. That's federal law. Dress code. What kinds of dress can be a potential danger for employees? Earrings, open-toed shoes, necklaces, bracelets, fingernails, anything that can be grabbed by an individual. Clothing, tank tops, halters, camisoles, spaghetti straps, low-cut, overly revealing shirts and blouses are unacceptable. Shirts exposing the midriff, foul language, sexually explicit or otherwise offensive pictures or similar remarks are unacceptable. Shirts, skirts, dresses, pants that sag, pants that are too tight are unacceptable. Be professional in how you dress and let that reflect the reason that you're here. And the scrubs that nurses wear, we discourage those because you're not a nurse with the individuals, and if you're taking them out into the community, you don't want to look like the nurse serving individuals. You're just part of the group. Earrings, hooped earrings can be grabbed by individuals. Lanyards, necklaces can be grabbed by individuals, so be careful with what you wear. There is a grievance procedure, but go to your immediate supervisor first and try to discuss whatever the write-up might be. And if you feel it's unfair and you don't sign the write-up, but you can also come to the director of HR, who's Carla Walker. And if that doesn't resolve the issue, you can go to the executive director, who's Tara Roberts. Employees must complete an OGC grievance form found in the hallway behind the reception desk. Conduct violations. There are 32 violations listed in your handbook. Please be familiar with this list. HIPAA. Your personal information is protected by law, as is the information for the individuals you will be working with. No postings on social media are acceptable and can be considered a violation of HIPAA. Talking about the health of individuals with other people is a violation of HIPAA. Employees are also responsible to notify their supervisor in case they've been arrested. If the charges are dismissed or the employee is found not guilty, they may be reinstated. Reemployment. If an employee leaves in good standing and decides to return to OGC, they may be eligible for rehire. Disqualifying factors would be substantiated abuse, neglect, or exploitation.